Welcome back, guys. And before we continue, for those who have not subscribed, please consider subscribing, sharing, commenting, so that this channel may continue growing bigger and bigger. Back to our topic of the day. In this video, we are going to discuss about types of urethritis, diagnosis, or how you can tell a person is having urethritis, and also the treatment modalities which are available, or how you can manage a person or a patient having urethritis or inflammation of the tube that carries urine from the bladder to outside the body. So let's talk about the types. Urethritis is always classified by the cause of inflammation. One, we have what we call gonococcal urethritis. As the name suggests, obviously is caused by gonococcal or gonorrhea. Number two, we have what we call non-gonococcal urethritis. Let's talk about the gonococcal urethritis. This is caused by the same bacteria causing STI gonorrhea. Get this clearly. Gonococcal urethritis is caused by the same bacteria that causes sexually transmitted disease called gonorrhea. I hope you get that. And note this, and it accounts for almost 20% cases of urethritis. The second type is, as we have discussed above, or as we have mentioned above, is what we call non-gonococcal urethritis. Non-gonococcal, it means that it is caused by other infections that are not gonorrhea. For example, chlamydia. Let's talk about the diagnosis, or how can you tell, or as a medical personnel or a doctor, how will a doctor tell this patient is having urethritis or inflammation of the tube carrying urine from the bladder and outside the body? One, we have what we call through signs and symptoms. The patient will come to the hospital, clinic, and will explain how he or she is feeling. So from the signs and symptoms, a doctor is able to tell whether this patient is having urethritis or not. Number two, we have physical examination of the genitalia. When you examine the genitalia, for example, you will get discharges from the urethra, which may be pus, blood, and also may be smelly. This can lead to a diagnosis. Number three, we have what we call urine samples or vaginal swabs if the doctor suspects a sexually transmitted infection. So if you get vaginal swabs and urine samples and you take them to the lab, you will test for sexually transmitted infections, which are major causes of urethritis or inflammation of the tube carrying urine from the bladder and outside the body. Number four, we have what we call blood tests. Blood tests are used to check STIs like HIV and syphilis. Next, let's talk about the treatment modalities available, or if you diagnose a patient is having urethritis, how can you manage, or how can you treat this patient? So, treatment, as I have said, this condition is always bacterial. So, treatment includes antibiotics and antiviral medication. Remember, we said this infection can be, or this condition can be caused by a bacteria or a virus. So obviously, in the treatment we should have an antibiotic to fight the bacteria and an antiviral to fight the virus. I hope you get that. Let me give you some of the examples of the commonly used and local antibiotics, of which it's these are, most of you have came across this medication. One, we have what we call azithromycin, doxycycline, norfloxacin, erythromycin, ofloxacin, levofloxacin. I can't give the specific doses for this medication as it depends with the level of infection, and also it depends with the age of the client you are dealing with. That's why I'm not giving specific doses of this medication. But once you go to an healthcare provider, he or she will be in a position to determine your dose according to the level of the condition you are having, or according to the diagnosis after taking the vaginal swabs and the urine samples, the blood tests. So after arriving to a diagnosis, he or she will be in a position to determine the medication you are going to get. Note this, which is very important. If STI caused infection, if it's an STI caused infection, I hope you get that clearly. Let me repeat. If it's an STI caused infection, sexual partners, remember, have this, get this right. If ST is an STI caused infection, sexual partners should undergo testing and treatment. So for instance, if you get one partner, if it's the woman is having this kind of an condition, or if it's the husband or the man, you should do what we call contact tracing, or getting the partner and treating both of them. And what is the reason behind treating both of them? This prevents spread of the same disease, and also what we call reinfection. What do we mean then by the word reinfection? We might be talking about reinfection and maybe you don't know what it means. Reinfection means getting an infection you once had. For example, if you get malaria and you have previously had malaria, that is a reinfection. That means you got malaria, it was treated, and it came back. That is what we call reinfection. So, another point is, patients should comply with the treatment. You know, most of us, after taking the medication for 1 or 2 days, if we feel a relief, most of us fail to comply with medication. It's important to complete the dose according to the doctor's prescription. And also, partners should be tested and retested before resuming sexual activities. Partners should be tested, that is after treatment, should be tested again and retested to confirm that the disease has gone away before they resume sexual activities, to avoid what we have just explained, or to avoid reinfection. That marks the end of our discussion today, and in the next video we will be discussing about complications of urethritis, or what will happen if this disease is left untreated. Guys, thank you for the far you have taken me. Even if you have been away, you have continued subscribing and showing me support. Let me hope we are going to work together and promote this channel. Make sure it reaches as many people as possible. Maybe it can help your brother, your sister, your mother, or your relative. So let's continue subscribing, sharing, liking, and commenting. And if you have a condition you want us to discuss, you can just DM me, or you can put it in the comment section and we will be able to discuss it. I hope you have been blessed, and what I can say, let's maintain peace, peace, peace. Have a good evening.